professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'll be going over something called the nocebo effect. Nocebo effect is considered the opposite of placebo effect. Placebo effect is where a patient starts feeling better because they believe that there's a treatment that is making them better. However, in actuality, there is no medication there. It's a placebo. The opposite of placebo is something called nocebo, and many physicians and researchers do not pay attention to this. The nocebo effect is where if patients start believing that they are getting worse, then they in fact will start getting worse. And I'll go over a document that goes over the nocebo effect a little bit further. In this document, what I'll show you a bit more is about the nocebo effect. So for starters, what is it? And I'm going to read directly from this. The nocebo effect is the opposite of the placebo effect. It describes a situation where a negative outcome occurs due to a belief that the intervention will cause harm. It is sometimes forgotten phenomenon in the world of medicine safety. The term nocebo comes from the Latin to harm. So for adverse reactions to medicines, nocebo implies that the patients are more likely to experience an adverse effect if they expect or are worried about the adverse effect. So what are the key messages here? The nocebo effect can lead to real adverse reactions. Information on treatments should be carefully framed to reduce the risk of initiating nocebo effects. Side effects associated with brand changes may be due to the nocebo effect. So for adverse reactions, nocebo implies more likely to experience adverse effects. The adverse effects may be physically experienced by the patient and are often clinically diagnosable. An example of the nocebo effect is the severe adverse effects experienced by patients taking a placebo during a clinical trial. A lot of times, nocebo effect can be caused by something called media storms. And this is where widespread dissemination of concerns about an adverse reaction to medicine leads to an increase in the number of reports in the adverse reaction. For example, in 2013, the British magazine and media highlighted the adverse effects, including muscle pains of statins, following an article in the British Medical Journal. An estimated 200,000 patients stopped taking statins within 6 months of the story being published, many due to adverse reactions. There is also an increase in the number of rhabdomyolysis with statins during this time. And this was an adverse reaction to statins, supposedly. This incident has been since attributed to the nocebo effect. So the nocebo effect can also play a role in patients' experience with generic medicine. Pre-existing skepticism around generic medications may be a cause of side effects. So this is what the nocebo effect is. A Finnish report actually in 2015 showed that a quarter of patients discontinued and approved infliximab biosimilar were actually reporting not efficacy that was not as much than the original. So the infliximab biosimilar, according to patients, did not have as big of an effect as infliximab did. So these are all examples of areas where nocebo effect had a negative impact. I hope this provides you with some sense of what the nocebo effect is and in the context of what a placebo effect is. Thank you for listening.